Heated debates happening over when and how to safely reopen the U.S. economy as the number of COVID-19 cases in the country now surpasses 636,000. Thanks for joining us at 5. I'm Bob Clausen.
And I'm Ashley Ketz. And right now there are a total of 1,569 cases of COVID-19 in Arkansas. And though the numbers rising and the timeline of the peaks changing, the governor is reassuring us that we've been successful in flattening what that peak will look like. And here is a closer look at those case numbers. 1,047 are active right now. 83 people are in the hospital. A total of 33 Arkansans have died since the beginning of the outbreak. Officials say they're monitoring cases now in 28 nursing homes in the state, and nearly 490 Arkansans have recovered now, and more than 20,000 tests have come back negative.
Major announcement today coming from the governor as well regarding help for long-term care workers in the state. Jay Burr has more on that. Jay, a lot of things discussed today.
Yeah, absolutely. A lot to get to, but some big news, as you mentioned, coming out of that daily press conference today. I know our newsroom has been bombarded with the question of when are healthcare workers going to get those bonuses that the governor talked about weeks ago. We finally got an answer to that today. Today, the governor announced that Medicaid has finally granted the waiver to long-term healthcare workers. Now, the Medicaid waiver only applies to those workers in that specific setting, but the governor also said he will steer approximately $50 million from the CARES Act money coming to the state to allow for the same bonuses for those in hospitals and other facilities that are not covered under the waiver, and that does include janitorial, laundry staff, things of that nature. Now, all in all, about 75,000 healthcare workers will see these bonuses that will be dated from April 5th until the end of May. Now, these bonus payments can be extended if the state has 1,000 or more cases of active COVID-19, and the governor was relieved and pleased to see this finally come to fruition.
Well, we're doing this because they have voluntarily done this because they're committed to the patient, but it does put them at risk. And it covers those that are directly dealing with COVID-19 patients, but it's also recognizing those that are putting themselves at risk simply with the at-risk categories.
The numbers overall in the state of Arkansas for COVID-19 are not super high, but if you are a nurse or you're a respiratory therapist or you're a clinical person and you're taking care of someone with COVID-19, it's an all-consuming job. It's very labor intensive, it's high stress, and the fact that you could potentially get ill and maybe miss work or maybe worse, end up as a patient in the hospital yourself is very stressful.
And also some things to look at when potentially opening things back up. Officials say they will look at the data at the time, and now with testing being expanded to those who are just symptomatic, it should help to see more of where the state stands when it comes to this pandemic. Now, the latest models have been suggesting that May 2nd is now the peak of Arkansas's place in this pandemic. Governor did mention that even though that date has been moved back by that University of Washington model here recently, he says that is actually a good thing because they're lengthening and flattening the curve, and that's something he's been preaching since day one. Now, the governor is also working in tandem with some of the surrounding states on potential strategies that they can use here in Arkansas, but also potentially pass on to those other surrounding states. We've seen the West Coast states sort of formed a coalition. I think you'll see more of the same probably in the Midwest and the southeast part of the region as well. Live from the state capitol, Jay Burr, KRK 4 News.